every patient, every experience, every time. That's our motto here at Catholic Health. And today, we'll tell you how every detail of the new Patient Care Pavilion at Good Samaritan University Hospital was made with the patient in mind. I'm joined now by the two people in our health system who are probably the most qualified to talk about patient safety and experience, our Chief Medical Officer, Dr. Jason Goldman, and Chief Experience Officer, Christy Rowe. Thank you both for joining me today.
Thank you for having us.
Christy, we'll start with you. We're talking about this beautiful Patient Care Pavilion here at Good Sam, and specifically the enhancements that make this really the jewel of patient experience on the South Shore of Long Island. What are some of those enhancements?
Yeah, from day one, patients have been involved in the design of this facility. When the project launched, they started interviewing patients and community members about what they want in their healing experience and what they want from a hospital experience. And one of the themes that really came out was the utilization of nature and light. It can be so important when you're in a hospital and you're healing to have access to natural light. And so we have that in abundance here, right? Walking from the hospital to the ED, the beautiful grand windows, or in one of these beautiful patient rooms where you have the floor to ceiling windows, which is quite unique in healthcare, by the way. They've pulled that thread of light and healing through in this space in a way that's truly remarkable.
So not only were these decisions made with the patients in mind, the patients actually helped make the decisions. That is so cool.
Exactly.
And I believe there's also some patient decisions being made with opening day that also incorporates that feedback and perspective, which is so important.
Absolutely. The first thing that we're going to do is we're going to be giving our first patients to heal here a commemorative item. I mean, think about it. We've created a new space for generations to come to heal in perhaps some of their darkest times. That's really sacred. So we want to honor them and let them know how important they are to us. The second thing we're doing is we're training all of our fabulous volunteers on our service trainings and our standards. Volunteers have the biggest hearts and they want to do the best that they can, and we're going to arm them with the skills that they need to perform the service that they're doing for us. And then the final thing we're doing is, we're a listening organization here, and so we're going to be standing up some listening posts, some surveys to get right after a patient or family member leaves, or during their stay, leveraging the OneView technology to get feedback on the facility. I mean, we expect everything to go really well, and then if something isn't going well, what do we need to go and resolve quickly?
That's just the start. There's so much more. Christy, thank you so much. Transitioning over to patient safety with Dr. Goldman. Dr. Goldman, could you just first talk about how patient safety and patient experience complement each other to really enhance the quality of care?
Yeah, I would say not only do they complement each other, they are inextricably linked. We look at it as one journey of our patient. It's quality, it's safety, it's patient experience, and actually it's staff experience too. Those four things together, they make, if you picture a circle with a bullseye in the middle, when we hit on all four of those, we're hitting our bullseye of where we want to be.
Patient safety, something that is key, not just at the Pavilion here at Good Samaritan University Hospital, but throughout the health system at Catholic Health. Can you talk about some of the steps, some of the foundations of patient safety for our health system?
Great question. So we actually started our journey with what we call the Daily Patient Safety Huddle, where the leadership team in every campus, including Good Samaritan University Hospital, meets every morning. It raises situational awareness of really what's going on, what do we need to modify, change, adapt for the current environment to make our patients, again, safe, high quality, best experience stay.
That's excellent. So you're taking the best in patient safety, the best in patient experience, blending it together to offer the best possible care on the South Shore of Long Island. I'm joined now by the president of Good Samaritan University Hospital, Dr. Justin Lumby. Dr. Lumby, today we're talking about a subject that is near and dear to your heart, that's patient safety and experience. What are some of the elements here at the Pavilion that are really geared towards enhancing the patient's experience?
Yeah, when we began planning the Patient Care Pavilion, we had one commitment that we focused every decision on, namely putting the patient first. So how does the patient get into the building? How quickly do they receive the care? How is the team coordinating when they take care of the patient? And how is the patient getting the rest and experience that they need to have rapid healing? These things together really were the core of making sure the patient was placed first.
Everything patient-centered here at the Pavilion at Good Samaritan University Hospital. Dr. Lumby, thank you.
Tim, great to see you.